Good evening, everybody. Thank you for taking the time to be here today. I'm glad you all made it safely. Do you ever go out and see people do the craziest things? There is never a time I leave my house and I'm driving down the street or I'm walking through the aisle of a store and I don't look at somebody and just ask, why? Why are people the way they are? Like, what is going on in your head right now? I can't help but ask myself, would the world be a better place if y'all just went to therapy? Maybe you've asked yourself the same question, so today I will be informing you on psychotherapy. I would like to begin by I'll be covering 3 types of psychotherapy, a couple of techniques, and how someone who makes the decision to get this treatment can get the most out of it. I would like to begin by discussing 3 major forms of psychotherapy, which are psychoanalytic, cognitive, and humanistic therapy. Psychoanalytic therapy is long-term talk therapy where a patient will go see a psychologist once or more a week. The psychologist will help analyze the development of the person from their past or their childhood. According to psychoanalytic perspectives on developmental psychology, the counselor can help the patient understand natural unconscious behavioral patterns as an effect of interactions from the childhood, typically from parental figures. This form of psychotherapy is intensive to understanding a person's personality. It also helps understand unconscious habits formed through conditioning in early childhood. To help understand, they can work together to analyze the patient's ego, emotions, and relationships with objects and people. Our next form of therapy is cognitive therapy. Dr. Alaraka suggests that cognitive therapy works by challenging a patient's set of beliefs and behaviors. This is one of the most well-known types of therapy. For an example, say you made plans with a friend a week in advance. Throughout the week, you text your friend trying to solidify these plans and they don't respond to you for hours or even the whole day. You may become anxious or sad that maybe your friend doesn't want to follow through with the plans. A psychotherapist would help you question maybe that there's other situations that your friend isn't responding to you, such as they are busy or they are working. Our next type of therapy is humanistic therapy. This does not focus on what is wrong with the patient or understanding the patient's past. It's more of how a person can handle their emotion at that moment. Mindfulness is a large part of humanistic therapy to help the patient self-realize and understand how they are feeling. This type of therapy is based on the idea that people are inherently good. So to take a step back and realize how you are feeling, it can help the patient understand the next course of action that will help them identify best with themselves and how they want to be perceived as the world. I am statements are oftentimes used to help the patient understand how they're feeling and recognize that. Now that we discussed 3 different types of psychotherapy, we'll now talk about different techniques a patient can use from psychotherapy. Techniques, mindfulness and relaxation, as well as emotional regulation, can be used. A good way to be mindful and relax is through meditation and breath work. I've recently been reading a book called Don't Hate Meditate by Megan Monahan. There's a quote in the book that I like. It says, "When you're quiet, everything settles on the floor like sediment in undisturbed still water." In this book, I've learned that meditation isn't about silencing your thoughts, but more of letting your thoughts pass without judgment and bringing your focus back to your breath. Emotional regulation is another technique a patient can use from psychotherapy. Positive self-talk to replace negative self-talk, such as replacing "I'm so stupid, I can't do that" with "I'm smart, I don't know how to do that, so I can figure it out." Calling upon your best self is another part of emotional regulation. Again, how you can think about how you actually want to be perceived. Thinking about role models can help you relate back to how you want to be perceived in the world. Now that we've gone over 3 types of psychotherapy and a couple of techniques, we will now talk about how someone who makes the decision to receive this treatment can get the most out of it. Choosing a therapist, defining goals, and revealing yourself are good ways to get the most out of therapy. Choosing the right therapist is crucial to your treatment. It's important to feel comfortable to the person that you were talking to. That way you don't feel resistance for opening up to them. Recently, I've met with a therapist, and she was specialized in working with toddlers and children. So whenever I was opening up to her, it didn't feel like she really knew how to help me with my specific needs. Defining goals is a good way to know what you want to get out of therapy. A therapist can ask the right questions, but knowing what you specifically want for your life will help you and the therapist work towards those goals. It also is good for tracking progress for short term and long term. Good goals to have in therapy are coping skills, getting to know yourself better, and understanding your past. That way you have the power to move forward. Revealing yourself is another step to get the most out of treatment. A therapist is not always going to be there to tell how you are feeling or how you are reacting, so being able to identify how you are feeling when you're away and then going back to express yourself is important. Last but not least, being open to change and taking the therapist's advice, as well as expressing dissatisfaction with the techniques that the psychologist is using on you. That way you can modify your treatment according to what's going to help you best. I would like to close with the following statements. We have specifically covered 3 types of psychotherapy, a couple of techniques, and how someone can get the most out of therapy if they decide to get this treatment. I hope I have successfully informed you about psychotherapy and a few of its elements. I would like to end by everyone taking a deep breath in through their nose, holding at the top for 2 seconds, trying to be present, and out through your mouth. Thank you for all openly listening and receiving my research.